Hi Jessica, how are you today?
Good, Evelyn. How you
Good,
doing?
good, good.
I'm
Um,
really happy for this day.
yes, I'm happy to. I'm glad we are here today. I want to let everybody know that we are so excited because we are bringing something amazing today to
Yes,
our English speaker people. We've been doing a couple of videos in Spanish,
yes,
but we want to bring this also to our English speaking community. Everyone out there, what we are going to provide for you guys is something amazing, something that's going to benefit a lot of people. And we're here. Like I said, my name is Evelyn. This is Jessica, and
yeah.
we're going to give you guys some good information.
Yeah, we're gonna start you guys a little bit of what Medicare is and what is the history and what can do for you or your family members or somebody that have the qualifications for Medicare. So Evelyn, I'm
Exactly.
so excited
And
for this.
stay to the end because not only Medicare, we're also going to discuss a little bit about Medicaid today. Okay?
Exactly, as well. Yes.
So, perfect. Here we go.
Okay, so before 1965, million people in America, the adults and more the elderly people in United States, they couldn't afford private insurance. So the health insurance was like a luxury situation.
Exactly.
So many insurers reject them because of their age, because of the pre-existing conditions, as well as living of thousands without medical, you know, care. So that was a big thing in the area. So our president was kind enough to, they come up with a great solution, right, Evelyn?
Exactly. So in July 30, 1965, everything changed. And that's a good thing that it changed a lot for the population that didn't have health insurance after they turned the age of 65. President Lyndon B. Johnson signed the Medicare Act. That means that the first president that actually received his Medicare card was President Harry S. Truman, that he was able to utilize the Medicare services, so that he can benefit and have that health insurance.
Yeah.
And that's how everybody else started getting their Medicare benefits.
Yeah, and a year later, in 1966, Medicare officially began within the main pillars. So, Part A, that you know, guys, or the one that don't know, it covers the hospitalization part,
Right.
is the hospital care. And then the Part B, that's the medical side of the benefits. And then the doctor's visits, services, and medical equipment, those are covered for your Part B. So it's really important to have both.
Yes, perfect. And that's really good because they have Medicare Part A and Part B, and they can use it for the doctors and the
Exactly.
hospitalization.
Exactly.
A couple of years later, between 1970s and 1980, they added coverage for people that have disability and end-stage renal disease. That was like an extra help for the people that were younger than 65 that have any renal failure or any disability. So that was really, really good. That was added after.
Yeah, that's great. That's really great. So in 1997, Medicare Advantage was born. That's the Part C that most people know.
Yes.
And was created allowing with private companies offering additional plans to the people that qualify for Medicare. In 2003, under the President George W. Bush, the Part D was added. It began in 2006. It was giving millions of people access to prescription coverage.
Exactly, Jessica. And today, um, nowadays, if you see the statistic, more than 65 million people have both coverage for Medicare over the age of 65. And they also have the young individuals that have chronic illness that do qualify for Medicare or have the disability.
Yeah, that's really great because people that have disability that they really need the assistance and they don't have the capacity to work. So this is wonderful, because
Exactly.
they really thought about everybody in a way.
Exactly. and that helps a lot of people, especially if they are low income people,
Yeah,
or they don't have the funds to pay for the health care. At least they have the Medicare that's going to help
exactly,
them out.
exactly. Yeah. With what does original Medicare A and B really means? That's, a lot of people is like, yeah, Medicare. They don't even know what is the A and the B,
Exactly.
what each one does. So that's why we wanted to create this channel, to just educate you guys and give you information. Because both as a professional license in different states, we just
Exactly.
want to help people. So the foundation of Medicare is still a Part A and a Part B. Together, they pay about 80% of approval medical costs to you guys. So basically, you are responsible for the other 20%.
The good thing is that the remaining 20%, that's going to be the person's responsibility. But the good thing is that they have something called, that is a supplemental insurance, that is called Medicare, that will cover the rest of that bill once you get it.
Yeah, this option work well for those who they want freedom, to
Exactly.
just choose the doctors, hospitals, and network wise, for those who prefer predictable medical expenses,
Exactly.
basically, Medicaid is it's an extra cost,
Yes.
but the cost, it could be less than $200,000 or
Exactly.
in $100,000 bill. So
Exactly. And the good thing is that if people want to see lower monthly premiums, that's when the Medicare Advantage Part C comes in, and they'll have all the payments into one pocket instead of having different, paying A, B, C. Everything's going to come out from the same account if they add everything together.
okay, these plans bundle Part A and B, and often D, prescription drug coverage. On top of that, they include extra like dental, vision, audition and hearing, transportation, and even gym memberships.
And the good thing is that they can have everything under one network, and they can see providers that are in network with the plan.
That's
And
great.
that's where, when we come in, and we'll, according to what the needs are of the people, we can just see what's best for them, what they need, or what do they want to add, and we can have everything in network for them
Exactly.
into one whole bundle account.
Yeah, Medicare is based on every zip code, so it's really important that you understand that what you can get is based on where you live and what zip code offer for
Exactly.
you guys. But we can, like Evelyn said, we can customize it for your needs.
Exactly.
That's great. So the key details of Part B deductible. This is most important because sometimes
Yes.
people are scared, Evelyn,
Yes.
or they don't think they wanted to get the Part B because it's a cost. It does have a cost,
Yes.
but it's really important for you guys to understand and know this is most important to get it at the time that you can subscribe to Part B, okay?
Yes.
One important detail of Part B has been an annual deductible. Until you pay that deductible, Medicare doesn't begin covering medical services. So that amount changes every year. It should always be considered when you're comparing your options.
Good thing is, Jessica, very important that people should subscribe for Part B. If not, they'll get penalized.
Oh, yes.
Like
Yes.
once you hit that 64 and a half mark, to age 65, you have to make sure that you sign up for your Medicare. If not, you will get penalized.
Yes.
And then we can also talk about it a little bit more into detail. Just let us know, and then, or we can just talk about
Yeah.
it in another occasion,
In
and then
another
just
video.
explain them.
Yeah, exactly. We could go more detail, but just we want to just give you a brief, a brief information so you guys can have that. But stay tuned. A reason to come back.
Okay, perfect. So now you guys hear a little bit of information about Medicare. Now, there's a good part. We're going to talk a little bit about Medicaid. Okay. So Medicaid was also created in 1965 along with Medicaid. And the reason that Medicaid was also created because there was a lot of poverty back in that time, and there was so many people without health insurance that bringing Medicaid as well to the table that help people with low income and a lot of people, families, children that didn't have health care.
Yeah.
And on top of that, that helped our people that were 65 and over that qualify to have Medicare and Medicaid.
Yeah, definitely. And with the Medicaid, the federal government and the states, they team up so they can provide those coverage for those thousands of people in need. Like Evelyn says, they have a poverty line.
Exactly.
Like we have a table that you guys need that table to know if you qualify. Just let us know and we can, send it to you on your way, so you can know about it and see if they can qualify for Medicaid.
Okay, perfect. And who qualifies? Our children, our pregnant women, and people with disability.
Seniors too.
Our adult
Yeah.
seniors do qualify for Medicare as well. And like Jessica said, we have to look at the table to make sure that you guys do qualify for Medicaid.
Yeah, remember, because this is a federal program along with a state program.
Exactly.
Every state have a different rules and different
Yes.
qualifications.
And
So
that's
it's really
very important, you know,
Yeah.
that like we're in the state of Florida.
Yeah.
So the rules for the state of Florida are different from the state of Texas or California or Michigan or any other state. So that's very important that you guys look into that or let us know which state are you guys in so that we can help you
Based on their
based on their
state.
state laws.
Yeah, definitely. So who qualifies for Medicare? Medicare benefits include doctor's visit, hospital, transportation, prescriptions, and physical therapy, mental health care. That that's important. That now
Yes.
in these times that we live in, God bless the
Yes.
world, and now we are acknowledging
Yes,
the
the
mental health, and
important.
then appointments. So you need an appointment and you don't have transportation, they pay for you to go to the doctor, or you can have somebody and then you can claim that money for the gas. They do that for you. So in a states, even they include the dental and the vision. That's what we're saying. Some states, not all the states, but some they do.
And the best part, Jessica, is that Medicaid is either at no cost or they'll have to pay like a small premium. It depends, you know, what
The
your income is.
Yeah.
And then we'll go basic on all of that, you know.
Yeah, that's really, I think Medicare, honestly, it was created really looking America. When I go back, everything that is happening right now is a situation, but when we see the foundation of this country,
Correct.
they care,
Exactly.
and I think that's why most people at the end of the day, they end up loving America because the foundation was great,
Exactly.
you know, thinking about the elderly with Medicare, thinking about the poor people with the, with the Medicaid and disability, people that cannot take care of themselves. They thought about it, it created a system for all this. So we bless that we live here, right?
Yes.
So if you already have Medicare, here is the good and the interesting and fabulous news, okay? You can also qualify for Medicaid even that you have Medicare. And you're gonna say, Jessica, how is that? Well, remember how we told you about it? That every state has different rules and that it's a poverty line. So guess what? If you really are holding like to have a low income, depending you stay, you can have a dual eligibility. That's the way they call it. You have Medicare and also have Medicaid. And in case Medicare pay first all the bills, and then Medicaid pay the covers that is left over. That's great, right? So the copays, the deductibles, and the extra services, Medicaid take care of that for you. So that's a good way to know.
Jessica. And that's really good because people get that extra help that they need.
Yeah.
And we're not done yet.
No.
On top of that, there's an other help that people can qualify for. It's called the LIS, or the Extra Help Program, which help with the cost of Part D medications. So on top of your going to the doctor, going to the hospital if you need any other like transportation, you can also get the help for Part D for your medication. So you get that extra help on top of that. Some of the prescriptions can either be free or are at very low cost, and that helps a lot with the people with the lower income that cannot afford to pay for their medication.
Definitely. That's great. As you see, Medicare and Medicaid aren't one size, okay?
Fits all, yes.
Fits all. The key is finding the right plan for you and you health and lifestyle. So, and that's where we come in, you know. We as a health licensed agent from different states, we main in Florida, so our license first is here, but we do have multiple licenses in different states, and you know that's what we're here to help you. So we have the education, the information, so we can help you based on your needs, you know.
And to help them find the best option for them, you know, according to, like you said, to what their needs are. And don't forget, please, your health is very important. Make sure that you're looking out for your health. When you speak to us or with any licensed professional out there, make sure you tell them what medications you are taking, what medical conditions you are taking. And it's very important that we can find the best plan for you that fits your needs. And don't forget, your health is your treasure, and you deserve to protect
it with the right plan. Definitely. So remember, always like I said, Evelyn, your best health is today.
And don't forget to click on the
subscribe button and the bell. Touch the bell.
Exactly.
And please give us a thumbs up if you like the video and it was, you know, something that you can, you know, get education from that.
And if you need more information, just don't forget to reach out. You guys can send us a message or go into our website, and you know, it's just take a click away and we'll set up a free consultation. Okay, so you guys be blessed, take care, and we're here to help you. Jessica?
Yeah, definitely. Before the bill come, get the plan.
Yes, exactly. Be blessed, take care. Bye.